I have served in public office for 30 years as a state legislator, a state treasurer, and now as a United States Senator. But it doesn't take 30 years to know that the health care system that our citizens live under and live with today is expensive, it's wasteful, and it's horribly and painfully inefficient. The time for change is now. From my visits with doctors and nurses to seniors on Medicare to recent college graduates struggling to afford coverage, and, Mr. President, with dozens and dozens of small business owners that are frightened to death that they're not going to be able to continue in their business because of the rising cost of health care, it is clear to me that the time for reform is now. And this bill is the right approach. In Louisiana, the average family spends more than $12,000 each year for health insurance. That, Mr. President, is almost 100% of the earnings of a person that's working 40 hours a week at the minimum wage. Think about that. Only in one developed country in the world would we have a system that says if you go to work 40 hours a week or 50, you have the privilege of taking all of that money and having to purchase health care in the system that I guess the colleagues on my other side want to advocate for. That is wrong. We must drive down the cost to the government, to families, and to individuals, and this bill will begin to do that. Since 2000, the amount that working families are charged for health insurance has increased by 91%. That doesn't seem to concern my colleagues on the other side of this aisle. And if this Congress stood by and did nothing, those costs would nearly double in the next 6 years. With economists predicting that families in my state will pay a whopping $23,000 for insurance in 2016, an 85% increase. To state that a different way, that means if we do nothing, the average family in Louisiana will be paying 60% of their income for health care, if they can find it, and if they can get around the pre-existing conditions, leaving only 40% of their wages to cover food, education, children, housing, transportation, and everything else that families need their funds for. These are skyrocketing costs that are burdening families, not just in Louisiana, but in every state of the union. We don't have a choice but to change, and we cannot continue to rely just on the private market without reforms, without guidelines, without restrictions, without incentives to change. Our people will be priced out of the market. Maybe that's what they want. That is not what I want. Small businesses, as I said, are struggling to remain competitive and to turn a profit. In face of highly unstable, unpredictable healthcare costs, this is getting harder and harder. As chair of the Small Business Committee, I've held 23 hearings and roundtables just this year, and several of them have been focused on how current health insurance system is volatile and how those costs are hurting our businesses. Today, as I said, these prices are rising. Healthcare costs are increasing faster than the price of the products that these businesses sell, 4 times faster than the rate of inflation since 2001. Premiums for single policies increased by 74% for small businesses in the last 8 years. Nationally, 40% of small businesses say that healthcare costs have a negative impact. What are we supposed to do? Stand here and do nothing? That is why acting now, that is why this bill is so important, because the status quo is not sustainable. It is not sustainable for our government and the cost associated to it, not sustainable for small businesses. Even though families, businesses, and government budgets are being mercilessly squeezed by unsustainable cost, Senate Republicans are doing everything they can to argue for the status quo. Why? I don't know. Each day they find a new excuse for their obstruction. I wish, Mr. President, they had put the same amount of passion, energy, and creative thinking into contributing policy ideas to this debate as they have to delaying tactics. Every amendment they offered was sent was to send the bill backwards, not forwards. And they seemed hell-bent on defeating, not improving this bill, contrary to their statements here on the floor. Republicans have charged that we're rushing in to vote for this bill. I can say that only in Washington would 87 years be considered rushing. Only in Washington would 87 years be considered rushing. We have been debating this issue on and off for the last 40 years. Republican President Teddy Roosevelt made national insurance a plank in his party platform when he sought the presidency in 1912. Harry Truman in 1945, and then again in 1948. And we've heard this on and on. This has been a debate that's gone on for 87 years, and intensely for the last really 2 years, as our presidential candidates took to the airwaves in debate after debate, Republican and Democrat, outlining their ideas for reform. This hasn't sprung up in the last 2 weeks. This hasn't sprung up in the last 2 months. Millions of Americans went to the polls understanding in large measure what we needed to do to change the system. And so despite the rhetoric from the other side, that is the case, and the record will reflect that. Instead of coming to the table and working with Democrats to write a bill, Republicans chose to put party politics first. And I want to say I listened to my good friend Max Baucus this morning. And I myself, who had thought I had followed very carefully the work of his Senate Finance Committee, I was actually moved to hear the number of meetings, dozens and dozens, maybe hundreds and hundreds of meetings that he attempted to have in a bipartisan nature months ago, years ago, with Republicans. And then at some point, they just decided they thought the politics was better than the policy. I think they made the wrong choice, and we will see. So they fabricated death panels, distorted Medicare cuts, undermined and disrespect the role of government in protecting its citizens, and they have engaged in a relentless misinformation campaign aimed solely at using fear to sway public opinion against this bill. And recently, just yesterday, Senator John McCain, our colleague from Arizona, has claimed that the American people are opposed to reform, and he speaks about the will of the majority. I'd like to remind respectfully my colleague from Arizona that the will of the majority spoke last year when they elected President Obama to be president, and they decided not to elect him. And the president is carrying out the will of the majority of people to try to provide for them hope and opportunity in an area that has eluded us for 87 years. And Republican presidents and Democratic presidents have tried and tried. This is a good effort, a strong effort, and most certainly, I believe, the will of the American people is being heard. They have tried to paint a picture of a nation opposed to health care reform. Recent polls show otherwise, and I'd like to explain that in just a moment. When we cut through all the misinformation and scare tactics that Americans hear, when Americans hear what's in this bill, they overwhelmingly support it. According to a recent CNN poll, 73% of Americans support expanding Medicare for the poor. Now, we haven't decided whether that expansion is going to be 133% of poverty or 150% of poverty, but Americans know what most of us know. Most people on Medicaid are working poor. These are people that wake up early in the morning. They work hard all day. They go back home at night, often by taking public transportation because they don't have an automobile. They work hard. They are American citizens. They just don't have enough money to spend 60% or 80% of their income on health insurance in a broken, unbridled, unfixed private market. And so we joined together with our states to provide them a minimal care through the Medicaid system, and I support that. And in this bill, the federal government will pick up a large share of those costs until states can adjust their budgets. I don't know what else we could do. We could force their employers to carry them. We've decided against an employer mandate, and so it becomes a partnership between the federal government and the state to help the working poor. It also shows additional regulations on insurance companies are very popular, favored by over 60% of the American people. They want Congress to regulate insurance companies, and we are going to do that in this bill. I'm one of the Democrats that didn't want to eliminate insurance companies. I believe in private markets, but private markets have to be framed correctly, and there have to be certain rules and regulations in order for that private market to work for everyone engaged in it, not just those with the wealth, not just those with the inside scoop on how private markets work. And so we are maintaining, hopefully, a more healthy insurance industry, not coddling it, but encouraging it to be competitive and to provide services and coverage for people in our country. But a recent poll by the Mellman Group shows that this support exists not only in Louisiana, but in all states. In my own state of Louisiana, specifically, though, it said, when the bill was actually read to voters, 57% of Louisianians supported the bill, with 43% strongly supporting the reform effort. And I'd like to read the language in the poll, because people say, oh, you can say anything in a poll, which is true. And if pollsters aren't reputable, they can twist and distort. So I'm going to read for the record this description of the plan. The plan would require every American citizen to have health insurance and require large employers to provide coverage to their employees. It would require insurance companies to cover those with pre-existing conditions and prevent them from dropping coverage for people who get sick, while providing incentives for affordable preventive care. Individuals and small businesses that do not have coverage would be able to select a private insurance plan from a range of options sold on a national insurance exchange. Lower and middle-income people would receive subsidies to help them afford this insurance, while those individuals who like the coverage they already have will be able to keep their current plan. This is a very accurate description of this bill before us, the Patient Protection and Affordability Act. It's very accurate. It is not a government takeover. There is no public option. There is a national plan available now to every American, just like the members of Congress and the federal employees have. There will be exchanges like shopping centers where you know where they are, you can access them, and when you want to shop for insurance, you can go there and shop for insurance, just like you go and shop for clothes or cars, et cetera. It'll be transparent. The prices will be more transparent. Administrative costs will be lowered. You don't need a PhD to be able to read these policies. They will be written in English, and they will be choices of yours. This is not a government takeover, as the other side has claimed. And that is why 57% of people in Louisiana, when given the right information, without the rhetoric, without the railing, without the distortions, say absolutely, I'm for a public-private partnership. I don't expect the private sector to do everything. I don't expect the government to do everything, but we can do it together. That's the way people in Louisiana think. Very common sense, very practical. That's what this bill does. With the exception of two colleagues, getting back to the bipartisanship, and I want to say how much I respect our two colleagues from Maine, both senators from Maine, Senator Snowe and Senator Collins. I had been myself in dozens of meetings with both of them and know that they struggled mightily to find a way to meet us to support this bill. I have not in the last few days spoken with them, so I won't discuss their reasons. I'm sure that they will express those on the floor, but I can say they are the exception to the rule. There were only two Republicans that, in our view, and I was in most of the bipartisan negotiations, really tried throughout the whole process. I know that Senator Grassley and Senator Graham and Senator Bennett and a few others engaged early on, and I want to acknowledge and appreciate their goodwill. But unfortunately, the leadership of the Republican Party chose the no way, my way or no way highway. They chose politics over policy. And here we are with a bill that's only supported by Democrats, albeit a compromise, and albeit many of the ideas that some of the more forward-thinking Republicans had are in this bill. So I guess it's easy, to stay unified. We've been criticized for not being unified. We now have different factions of our party criticizing why can't Democrats be as united as Republicans. I've said it's easy to be united when the only word in your vocabulary is no. And that's the only word in their vocabulary. But our vocabulary is filled with yes this and yes that, and yes, we want to try to find a way. So it's been difficult because some of us come from very conservative states, some of us come from very liberal states, some of us have very diverse populations in our state that have different needs and different views. So it's not been pretty, but it's been a practical and hopefully positive exercise that will help bring comfort and support and strength to the American people and to our economy. I know that my time is fast closing, so I just want to add a few more thoughts to why I support this bill. I stood here on the floor of the Senate to announce my intention to vote in favor of bringing Senator Reid's melded bill to the floor. At the time, I was very clear that my bill, that my vote at that time was not an indication that I would support that bill when it was brought to the floor. My vote was to bring that bill to the floor to do our work. Through weeks of floor debate and amendments and round-the-clock negotiations, that work has been completed. And we've produced a health care bill that is significantly improved from the one that came to the floor. And I would like to share a few thoughts about why, in my view, it is improved. Through tough negotiations, Senate Democrats have developed a consensus that blends the best of private and public approaches to reduce cost, expand coverage, and increase choice and competition for Americans, and have done so without a government-run public option. That was in the bill when it came to the floor. It is not now. I supported that change. I know it's been tough, but that is what the compromise is about, and I am proud to support it. Since I continue to hear distortions from my colleagues on the other side, let me be clear about that. We reached an agreement to provide private health insurance plans to be sold nationwide. The Office of Personnel Management will negotiate lower premiums just as they negotiate the plans currently available to federal employees and to members of Congress. Importantly, we ensured in that compromise that at least one nonprofit plan will be offered in every state, and states can't opt out at the whim of any governor or legislator. So everyone in America, as promised by the president, will have access to basically the same type of insurance that federal employees have. And for the first time in our nation's history, that will be the case. In addition to the bill that is now before us on the floor, that wasn't as it moved out of committee, there is additional cost containment. The fact of the matter is this bill is completely paid for. It will reduce the deficit by $32 billion and as much as $1.3 trillion in the following 10 years. Based on our efforts, the Congressional Budget Office and the nation's premier economists have confirmed that premiums will go down over time or remain at least stable so that wages for millions of Americans can increase. When this bill is passed, 31 million uninsured Americans will have access to quality health coverage. This bill achieves this goal by streamlining the health insurance market, ensuring efficiency, and limiting insurance company administrative cost, and to some degree, it will limit their profits. It also imposes an excise tax on insurance companies with high-cost plans. This will encourage employers to be more value-conscious purchasers of health insurance. And, Mr. President, I understand the House of Representatives does not have this in their provision. I would strongly urge this provision to be in this bill when it returns. I know there is fierce opposition to this on the House side, but this is the one provision, or one of the most significant provisions, and the President has said this publicly and privately to us. This is one of the most significant provisions that will help drive down costs to the entire healthcare system. It cannot be jettisoned at this point in the debate. Now, I understand no taxes are popular. People like to have $30,000 and $35,000 insurance plans. They're entitled to those, but we're not going to subsidize them any longer. We can't afford it. It's as simple as that. So you can have $30,000 insurance, you can pay for it yourself, but taxpayers can no longer subsidize that kind of inefficiency. When you can go to the private market under the new system and hopefully get a good policy for $10,000 or $12,000 or even $15,000, taxpayers can no longer and will no longer subsidize expensive, excessive insurance policies. That must be in the bill for me to have the final support. We've also created administrative savings through insurance exchanges, et cetera. And as my colleague from Vermont, Bernie Sanders, put his stamp on this bill, and I'm proud to support him in that, we've significantly expanded community health clinics. There's $2 billion more for community health clinics in this bill today than there was when it moved out of committee. That is an improvement that I was proud to have helped brought to fruition. As I said, there are exchanges that were in every different version of the bill. I won't go into that, but I will go into just a minute support for small business. When this bill moved out of committee, when I gave it my vote to move forward, there were some provisions for small business, but I'm proud that in this bill there are an additional $14 billion of help for small businesses, led by Senator Lincoln, Senator Stabenow, and myself, and others, members of my committee, Senator Shaheen, Senator Cardin, Senator Hagan, Senator Bayh, and others, worked very diligently to convince the leadership that small businesses needed additional help and that they couldn't meet the requirements of this bill without immediate tax credits, without expanding opportunities for them, and that has been done, and I'm proud of that work. In Louisiana, that means that from the bill that came out of the committee, the melded bill, to this bill, 50,000 businesses will be helped. 50,000 more businesses will be helped. I'm proud of that. Through the work on the Senate floor during this public debate, we have made a good bill, the melded bill that came from the Senate committees, a better bill for small business, the one that is on the floor today. And I'm going to submit for the record another 12 items that have been included that help small businesses today. And finally, I see my colleague. I want to just a moment about seniors and about care for children. Despite claims from opponents of the bill, we've taken important steps to strengthen Medicare, not weaken it. The Senate Health Care Reform Bill creates an independent Medicare advisory board to find ways to reduce cost over time and improve quality, and moves to a system that rewards quality over quantity. Yes, people like Medicare, and many of our citizens are on Medicare, but they don't want it to be wasteful, and they know that in many instances it is. So let's stamp out the waste, the fraud, and the abuse, and let's take that money, give it back to them in a better, more strengthened system, and that is what we're doing. Our Republican colleagues have tried to scare seniors into opposing this bill. The AARP and many senior organizations, despite that, are continuing to support this bill because they know that it improves care for our seniors, including basically free prevention and wellness visits that seniors don't have today. They will have when this bill passes, including a reduction of 50% of prescription drugs that seniors don't have today that they will have when this bill passes. And finally, Mr. President, care for children. These provisions I'm proud to have worked on. Again, when this bill came out of committee, this provision was not in the bill, but I helped to negotiate it. I'm going to talk about it for a minute, and I'm very proud of it. In the underlying bill, one of the principles of the reform by many people was that children should be able to remain on their parents' plans up until the age of 26. Now, I have children. I'd like to think by 22 or 23, they'll be on their own, they'll be gainfully employed and off of my payroll. This is what I'm hoping for my children. But any of us have raised children understand sometimes it takes a little more time to launch these children. I see the Senator Shaheen, who's nodding. She's done this herself. It takes a little time to launch them. And so under this bill, we said, okay, since they're out there in college with no access, they never think they're going to get sick, so they don't have insurance. It's expensive sometimes to find coverage for them. We've decided in this bill, one of the great reforms is that when the president signs this bill, every child up to the age of 26 will be able to join their parents' plan. No questions asked and with reasonable cost. But I asked myself the question, because I've worked a lot in foster care, where do the foster care children sign up? Because they don't have parents. And when I couldn't get an answer to that, I decided to start working on something for them. 26,000 of them age out of our system every year, 26 to 29,000. They don't have parents. So when I asked what plan will they join up with, there wasn't one. So I created a provision in here. Every foster care child that ages out of the system starting in 2014 will be covered through Medicaid up to the age of 26. This will guarantee when a child beats the odds, goes through a failed long-term foster care system. In many years, I've had children tell me, Senator, I studied in the back of an automobile, freezing cold because I was homeless when I was 18. Despite that, they ended up getting 4.0s in high school. When they are offered a scholarship, they will be able to leave California, like this one child told me, and go to get his scholarship at Harvard, and his insurance will follow him. That provision is now in this bill. It wasn't when it left committee. I will be proud that the 30,000 approximately children that graduate out of, not graduate, that's not a good word, they age out of a failed system, will now have some support at least, just like other children have in this country. And finally, I'll just say a word about health insurance. Because of the work that Senator Rockefeller and Senator Nelson have done from the committee to the Senate floor, insurance companies, and Senator Feinstein had a lot to do with this as well, insurance companies will have to toe the line. Mr. President, they no longer will be able to just take premiums, which they do today, and just spend it willy-nilly, either invested or profits, et cetera. I'm not saying that anything is illegal about that. That's fine. But this bill is going to say if you collect premiums from people, you have to spend at least 85 to 90% covering their health care. You can't just take their premiums and then deny them coverage. Those days are over forever. And I am proud to have worked on insurance reform. Again, I don't want to eliminate insurance. I want to reform insurance, and it is reformed in this bill. Unfortunately, the Republicans do a lot of talk about reform, but when it comes actually down to reforming, particularly the insurance industry, they are nowhere in sight. So I hope that I've explained a few reasons why I feel confident that this bill is moving us in the right direction. While I was hesitant to vote to bring it to the floor because it did not contain some of these provisions, through hard work and good faith and tough negotiations and keeping our eye on the ball, Senate Democrats have actually crafted, in my view, an extraordinary piece of legislation that will go a long way to providing comfort and security to the American people that elected us to do so. I'm also confident that it is popular. It may not be very popular today, although there are polls that indicate that when given the right information, it is extremely popular. But it is the right thing to do, and that's the most important. And so I'm glad to submit my full statement to the record. I've given a few reasons why I am proud to support it, how disappointed I am that my colleagues on the other side are still fighting the battles of the last election. The American people has spoken loudly and clearly. They have elected President Obama to be our president. They have elected us to lead, and that's exactly, Mr. President, what we intend to do. And I yield the floor.